Welcome back to the Business Experience Show. We are talking with Dr. Gregory Vigoren of Vigoren Dental. And I remember your name because you're full of vigor, Dr. Vigoren.
Thank you.
Welcome. Hey, I wanted to touch base on something, and we feel like you're a unique dental practice. And there's a number of things that you do in your dental practice that really takes patient care to the next level, like magnification, education. Can you share a little more information about that?
Well, one of the things that I think is important for all dental care is utilizing magnification. Magnification is a two-part. It's magnification and illumination. And you can't believe how much magnification has to do with seeing things and understanding them and communicating about them and controlling motor skills and improving outcomes. And so it's an entire area of dentistry. And after your desire to want to do the very best, it is probably the most influential thing that you can incorporate into your practice. And some of those things are loops and lights and microscopes and cameras and digital screens and
so
digital
using
X-rays.
photography, you're able to zoom in on someone's teeth or tooth and go and show them, besides just the X-ray, what's wrong with their teeth.
Yeah, it's way beyond the X-ray.
I mean, that's very powerful.
The traditional way was to show someone a picture of a flat tire and tell them they had a flat tire, and when you could show them that, it wasn't about, trust me, believe me, you got a flat tire, you could show
Right.
them. But I think even more powerfully than that is if you photograph all the procedures in steps, and the dentists that are doing the best job out there are making decisions on every procedure 10, 15, 20 times during the procedure, and all those decisions are taking more time and more energy and taking but they're affecting outcomes, and without seeing those things, the patient just thinks that you're overcharging and you're slow.
Right.
So
I've never been to a dentist that did photography like
why?
Like
Why
you
did
do.
more dentists not use those types of magnification? I would think that they should.
Well, it was one of those turnip truck discoveries. I fell off the turnip truck and I realized that patients really, I could talk somebody to death. But if I just showed them the picture, it was so obvious why we were doing things and why we were doing things different, and how the outcomes were different, and how outcomes were more predictable or durable or comfortable or functional.
You photographed the teeth during the process to show this is what I did with your teeth. Here I removed your crown. This is what's under your tooth, and this is what we're doing next.
Well, what we're finding is that most of the problems in the mouth, and it goes back to the systemic question, are about bacteria. And if you can keep the tooth, if you can clean the tooth out and clean out contamination, you get better seals, and the seals last longer, and the restorations hold up better. And it's those attentions to detail that allow you to change the length or the lifespan of restoration from 3 years and start getting 10, 15, 20, sometimes 30 and 40 years of longevity out of dental restorations.
Well, part of that's a testament to you, because I'm not suggesting that you're old in any way, but the younger dentists are probably more comfortable embracing the new technology, and so to the extent that you're able to make a change from the way that you practiced 30 years ago to that you can embrace technology now. It's like those people that resist the computer or the internet. There are plenty of dentists that still use the Gracie or the Ball tools, and they figure that the tools are the same, and that's what they use, and they don't do anything different from what they've known for 30 or 35 years. I think it's great that you're embracing the new technology. It's probably necessary also in your field to be able to provide quality services for your patients.
Well, counselor, excuse me for the joke, but that's a yes and a no question. Some things in 40 years haven't changed, and other things are changing daily, and part of the commitment to providing the best quality and care is to constantly to be a continual student, and so we spend a tremendous amount of time in continuing education in all different fields, of which medical health update preventative issues are one of those things that I told you has been a hobby for over 35 years. But the basics of restorative dentistry, the materials are changing and some of the techniques are changing, but the core value issues are the same. You want to do something so that it lasts. You want to do something so that the patient is comfortable and it's going to be functional and it's going to be healthy for the patient. And if you're looking at a much higher level of magnification when you do this, the attention to detail automatically, without even thinking, improves.
Have you found that your bedside manner has to change also, that your patients now expect a different type of presentation or something that's different from the way that you would have practiced dentistry in terms of dealing with your patients in the last 35 years?
No, actually, it's very fulfilling, because when the patients can understand some of these things, they're much more appreciative. And they're much better referrals. They refer in for better reasons. He's not just a nice dentist. He's a really good dentist, or he's very caring, or he helped us with this issue or that issue that was non-dental, or this referral or that referral. And so it's really about caring about people. It's about trying to do the best you can, staying engaged, being a continual student, and understanding that this is a physical sport. We put out restorations that have to function in the mouth for long periods of time over with tremendous loads and forces.
Dr. Vigoren, I mean, it's obvious that you're very passionate about what you do, and I mean,
Right.
He's a dental artist, and not only that, but from the time that you've spent as a dentist, you've taken great pride in educating yourself and looking at various outcomes, various situations, and you're able to pass that on not only to the customers or the patients, but also other dentists. And do other dentists seek you out for that knowledge and information that you have? And if not, what are you going to do to get that information out there?
Well, I've been involved in meeting planning, putting on meetings, finding speakers for 35 years. And you give me too much credit. A lot of these, what I call it is, it's the information that I've learned over that time that is not common knowledge. And an awful lot of these things are just retrospective discoveries. I mean, some of them, you can't figure out what you're doing that's different. And it might take you 10 years to figure out, oh, I do that differently. That makes the big difference. Okay, but if you document all this stuff and you're seeing it, you learn a lot more. The ability to see your work while you're doing it at 25 to 125 power is a powerful tool. It's helping medicine. It's helping surgeons.
But that's what scientists do. They look at what they've done and they document it. They keep up with it. They make changes and improvements to it, and they share that information as they make new discoveries.
Yeah,
and that's kind of what I see from you.
Yeah, as a general rule, those dentists that have been involved in continuing education and have had to talk to other dentists about their work and show their work, those have been a category of dentists that has improved over the last 35 years consistently.
Now,
Where do you want to see your business go in the next few years?
Tahiti. No,
that could be arranged earlier.
I will probably practice for another 10 or 15 years.
Awesome.
If I'm healthy, I will bring in associates and train. We will be doing more educational issues.
I'd like to talk to you about some of the entrepreneurial things that you've done. You talked about some products earlier that you're bringing to the marketplace. First of all, why don't you talk a little bit about your pet project right now and what it is that you're looking to do?
Well, 5 years ago, we launched a company that had two products. One was a dry absorbent. You can go to the website. It's Wow Oral Care, and the two products are Wow, because that's spontaneous.
WowOralCare.com?
Yeah, Wow
Okay.
Oral Care will come up. But the first product is actually called Wow because spontaneously 85% of the people that ever use it say Wow.
Wow.
I
know,
used it and I go, wow.
I
First thing when
wanna
I used
be
it. That was
wowed.
pretty cool.
That's better than or ow.
Yes,
So wow
yes,
is better.
yes.
Good.
And it's just a dry powder that's a dentifrice substitute. You put it in your mouth and you can swish with it. You can brush with it, but it pulls plaque off and it kills bacteria. So right now that is being sold as a breath freshener. Okay, but it goes a lot deeper without getting into trouble. It's a lot more than just a breath freshener. The second product was, and again, this goes back to the turnip truck decisions, was actually, we came up with it, or the scientists that came up with it as a gimmick just to get people to try the first product, because that was nobody knew what a dry powder rinse was. So he came up with a spray whitener. Well, the spray whitener turned out to be the fastest, simplest, cheapest way to whiten teeth that we've ever looked at.
90 seconds.
Yeah, and
Wow.
it destroys.
Wow's already taken. You can't use that one.
Wow, 90 seconds.
And it destroys plaque and bacteria, and we see absolute remarkable results in the health of the tissue and the home care of patients. And I'm talking about 13-year-old skateboarders who wouldn't brush their teeth if you force them.
Is it inevitable that we naturally have to see a dentist, or are there ways that people, not that I'm trying to take business away from you, but if they can avoid seeing the dentist, what are your tips for that?
There is nothing I like better than make us need 2% of the dentists that we have. And it is doable. You have to learn how to control plaque in children.
Okay.
You have to seal these developmental holes, pits and fissures in teeth, and you have to understand that most dentistry inherently leaks because it was never sealed well, or the contamination was never taken out. And that's across the board, whether it's a filling, whether it's a crown, whether it's a root canal. We find leakage and contamination in almost everything at a microscopic
Quickly
level.
explain pits and fissures for our audience.
Well, pits and fissures are the developmental grooves. If you stick your tongue on the top of the tooth, if you stick your tongue on the top of the tooth, the groove that you feel, that's the pit and fissure. And developmentally, think of the tooth as an enamel castle.
Okay.
And when the strong enamel castle was made, and this can stay in the mouth for 80 years and hold up to chewing, the guys that were supposed to put the doors and the windows in never showed up. And so these developmental holes, natural occurring developmental holes, are in everyone's teeth. And when the bugs come, the hordes, the bacteria that cause disease, they go right into these open doors and windows, and inside the tooth is a Hostess Twinkie. It's a 24-hour buffet. It is the dentin, and that original contamination causes most dental problems the whole rest of someone's lifetime. So if you seal those or block those off early, you can stop the disease process. You can probably cut it back 90%.
Would you have
over a lifetime?
Would you have people that have had caps and fillings and things like that come back in and check and look at things again with the dentist? Let's say that it's been 10 years ago and they haven't been to a dentist at all and they have caps.
As I said, we have to kind of go slow and just pick one thing, and we take that apart and photograph it, and inevitably there is contamination and decay. And
that's just because of time?
Because of time and because of philosophy.
What are some things with your business experience that you would share for someone barely entering dental school or exiting dental school? What would you recommend? I mean, you've been a dentist, Dr. Vigoren, over 42 years.
Oh, you find mentors. You find people that have been successful. Mentors are looking for rising stars. I don't want to just retire and quit. I want to teach a whole new generation of dentists how to do what I think is in their best interest and their patient's best interest.
Sure, and if you can find a young dentist that you can shape their philosophy, that may be your exit strategy, somebody that can take over your practice.
Yes.
That's great. And I want to jump back into the entrepreneur between the dentistry and young dentists that are out there. And a lot of people these days are trying to run a business, and then they find new products like you have, Dr. Vigoren. How do you balance the two? I mean, just running a business by itself.
You have a passion for what you do and exactly running the business side. How do you
the problem is if you stay in the profession long enough and you stay a continual student, you see things. You're introduced to things. If you're an early adopter, you find all kinds of things in a 40-year career, and it's about not so much finding one. It's about limiting yourself and your energy and your focus to one thing and making it successful.
Keyword he just said is focus. Focus. And
the primary focus is, remember, it's not work if you have fun every day.
That's right.
It sounds like you have fun.
I have fun every day.
You love
but
educating
you also have to
people.
have balance.
Yes. And you love educating people, your patients. It seems like, in a sense, they become your friends.
That's exactly right.
Right?
It's a very big family.
Who did anybody help shape your career early on?
Oh, of course. I had mentors in school. Some of them are still my mentors. being involved with continuing education. We have, I know people all over the world that practice at the highest level, and we all know each other. Okay, and that's self-reinforcing, and it's my guess is it's like that in any profession, in any business.
What last things would you like to share with your listeners, Dr. Vigoren?
Oh, this has really been fun.
Well, I've got another one. What are some of the struggles? We only have a few seconds left. What's the biggest struggle, and how do you plan on trying to overcome it?
Well,
in your practice
we've probably gone through the biggest struggle this last 4 years, where people are pulling back, but we just had to work harder, and that's how we've gotten through it. And part of preparing in case there's another one will be the expansion of internet marketing and continuing education and things like this.
And we really want to see your name out there. I mean, you've been in business 42 years. That's a honor to be around and share that information. And what I like with someone like you who's open to that kind of change, because there's people that have been in business 20 plus years and they don't want to change their methodology.
Well,
you have to be open-minded.
You got to change.
Days.
You got to change.
Yes, you do. You got to roll with the times.